Hello, friends. I am Dr. Shivam Sunil. I am an MD psychiatrist currently working in Patna in the state of Bihar. Today, I'm going to talk to you about a disorder which is oftenly overlooked, that is, dementia and Alzheimer disease. Today, I'm going to talk about the early signs to detect dementia, and at the end, I'm going to discuss about the caregiver and some tips to proper caregiving for a patient suffering from dementia. As we all know that detecting a disease early and doing intervention early can has a positive outcome for a disorder. Same is the case with dementia. The more early we detect dementia, the more is the better outcome for the patient and better quality of life for the patient. We all know there are few early signs which are very much indicated and very much predictive of dementia, and anyone who sees these early signs among themselves or with people around him should encourage the person having this early sign to consult a medical health professionals. Early signs include memory loss, often not remembering what the person is doing, often not following or not remembering a recipe while they're cooking, often forgetting to switch off the gas while they're cooking. They may show difficulty with some task such as computing or a cognitive function. They might have language problem, frequent forgetting of few words during the conversation. Patient may show abrupt mood changes. They might get disturbance in their mood. They might be very much depressed, and you might find patients or people having dementia very disorientated at time. They might not know the way back to their home. They might become very disoriented to time, place. So whenever you spot these early signs, you must encourage the patient to visit a mental health professional so that further screening and further treatment can happen. Now, coming to caregivers, as people having dementia, they have restricted functions and they require caregivers. It becomes very important for caregiver to give intervention during the disease. The few points for a caregiver may include: caregivers should must understand the disorder, dementia, and the person suffering from it. They might have episodes of frequent forgetfulness. They might have a repetitive action. They should, rather than questioning it, they should understand their disease process and they should support them. They should create a routine for a patient so that the patient does not get disoriented. Furthermore, they must encourage the patient's independence, as with time their independence might get restricted. They should encourage person having dementia to do work by their own. They should communicate very clearly and easy language and about the instructions the people having dementia should follow. And the caregivers should they themselves must take care of their health and their mental health so that they are able to give and they're able to provide for the people suffering from dementia. Thus, the treatment is available, and early detection and proper caregiving can improve quality of life with patient having dementia. Thank you.